Picture this. You're 64 years old. You've been on the same blood pressure pill for 6 years. And lately, your ankles puff up by dinner time. You get a strange, dry cough that won't quit. And some mornings, standing up from bed makes the room tilt just a little. You've told yourself it's just age catching up with you. But here's the question. Nobody asked you at your last checkup. What if your body isn't betraying you because of the years? What if it's trying to tell you something about the very pill you swallow every single morning to protect your heart? Stay with me for the next few minutes because by the end of this video, you're going to know exactly which symptoms deserve a phone call to your doctor, which ones are usually nothing to worry about, and to one particular warning sign that most people brush off for months, sometimes years, before they finally mention it out loud. That one alone could change how your treatment is managed. Before we go further, I need to say something clearly because it matters more than anything else in this video. Nothing you hear today is a reason to stop your blood pressure medication on your own. Not today, not tomorrow, not after watching this twice. These drugs save lives. They lower the risk of stroke, heart attack, and kidney failure for millions of people every single year. And for the vast majority of patients, they do their job quietly and safely, decade after decade. What we're about to talk about isn't a reason for fear. It's a reason for awareness. There's a real difference between the two, and by the time we're done, you'll understand exactly why that distinction matters for your health. So let's talk about 3 medications that show up constantly in the medicine cabinets of people over 60. Amlodipine, Losartan, and Lisinopril. 3 different drugs, 3 different ways of working, but all 3 share one mission, bringing your blood pressure down to a safer number. And because they work through different mechanisms in the body, they don't all cause the same side effects. Understanding which drug does what can help you connect the dots if something feels off, instead of quietly assuming it's just getting older. Now, there is a version of this swelling that is not routine, and you need to know the difference. If the swelling comes on suddenly rather than gradually, if it becomes severe, if one leg swells up dramatically more than the other, or if it's paired with chest pain or serious shortness of breath. That's not a mention it at your next visit situation. That's a call for help right now situation, because those combinations can point towards something far more serious than a medication side effect, like a blood clot or heart failure. Knowing that difference could genuinely save your life. Let's move to the second symptom, and this one is famous in medical circles for being almost comically persistent. The dry cough. If you've been on Lisinopril for a while and you've developed a tickly dry cough that seems to come from nowhere, no fever, no mucus, no cold symptoms, just an irritating scratch in your throat that flares up at the worst possible moments, often right as you're trying to fall asleep. This is worth paying close attention to. Lisinopril belongs to a family of drugs called ace inhibitors. These medications work by blocking an enzyme that would otherwise narrow your blood vessels. And that blocking action is fantastic for lowering blood pressure and protecting your kidneys and heart. But that same enzyme is also involved in breaking down a natural substance in your body called buildup triggers a cough reflex that just won't quit. Here's what makes this particular side effect so interesting. It doesn't show up right away for everyone. Some people cough within days of starting the medication. Others take the drug for months, even years, before the cough finally appears. And once it starts, it tends to stick around as long as you keep taking the drug. There's no allergy medicine or cough syrup that fixes it, because the cause isn't in your throat. It's in the chemistry of the medication itself. The good news is that this cough is not dangerous. It doesn't damage your lungs, and it's not a sign your heart is failing. But it can seriously erode your quality of life if it's keeping you up at night or making you feel embarrassed in public. If this sounds like you, don't just tough it out for the next 5 years. Talk to your doctor about switching to a related drug class called ARBs, angiotensin receptor blockers, which includes medications like Losartan. ARBs work on a similar pathway, but don't touch bradykinin in the same way, which is why the cough usually disappears within days to a few weeks of switching. Now, let's talk about something that scares people more than almost anything else on this list. Dizziness, especially the kind that hits you the moment you stand up. You're sitting on the couch, you push yourself up to grab a glass of water, and suddenly the room tilts. Your vision blurs for a second, or you feel like you might lose your balance entirely. For a lot of people, over 60, this gets written off immediately as just getting old. But there's often a very specific, very treatable explanation, and it has a name: orthostatic hypotension. Here's what's actually happening. All 3 of these medications, Amlodipine, Losartan, and Lisinopril, are at their core designed to lower your blood pressure. That's the entire point. But blood pressure doesn't stay perfectly steady throughout the day. It naturally shifts depending on your position. When you're lying down, less effort is needed to pump blood up to your brain. The moment you stand, your body has to work quickly to push blood upward against gravity. In a healthy system, this adjustment happens almost instantly. But if your blood pressure is already lowered by medication, that adjustment can lag by a second or two, just long enough for your brain to briefly receive less blood flow than it needs. And that's the dizzy, lightheaded feeling you notice. Most of these episodes last only a few seconds and resolve completely on their own, but don't underestimate how serious this can be for someone over 60. A few seconds of dizziness is exactly how falls happen, and falls in older adults are one of the leading causes of serious injury, hospitalization, and loss of independence. This isn't a symptom to shrug off just because it passes quickly. Before we dig into each symptom one by one, it helps to understand why doctors so often prescribe these three drugs together, or move a patient from one to another over the years. Amlodipine works on the blood vessels themselves, relaxing them from the outside in. Lisinopril and Losartan work more on the hormonal signals that tell your blood vessels to tighten in the first place, just through slightly different chemical pathways. Because they act on different systems, doctors frequently combine two of them or swap one for another to get your numbers into a healthy range while minimizing side effects. That's actually good news for you as a patient. It means if one medication doesn't agree with your body, there is almost always another path forward. You are rarely stuck with only one option. It also helps to remember that not every side effect shows up the same way in every person. Genetics, kidney health, other medications you're taking, your hydration levels, even the time of day you take your pill can all influence whether and how strongly you notice these effects. Two people on the exact same dose of the exact same drug can have completely different experiences. That's not random bad luck. It's simply how individual physiology works, and it's precisely why self-monitoring and open communication with your doctor matters so much more than comparing notes with a friend or a stranger online who happens to take the same pill. With that foundation in place, let's start with something incredibly common, something so ordinary that most people never even think to mention it to their doctor: swelling in the feet and ankles. Have you noticed your shoes fitting a little tighter as the day goes on? Maybe you press a finger into your skin near your ankle bone, and a little dent stays there for a few seconds. Or maybe your socks leave deep grooves in your skin by the time you take them off at night. It's easy to chalk this up to standing too long, hot weather, or simply being on your feet. But if amlodipine is part of your daily routine, there's a very specific reason this might be happening. Amlodipine belongs to a class of drugs called calcium channel blockers. Its whole job is to relax the smooth muscle in the walls of your blood vessels, especially the small arteries, so blood can move through more freely and your pressure comes down. That's a good thing for your heart. But here's the catch. When the small arteries relax more than the small veins do, a tiny pressure imbalance is created at the capillary level. The result is that a small amount of fluid seeps out into the surrounding tissue, usually settling in the lowest parts of your body where gravity pulls it: your feet, your ankles, sometimes your lower legs. This kind of swelling is usually painless. It tends to build up gradually over the course of a day and often looks a bit better in the morning after you've been lying flat all night. In most cases, it's not dangerous, but it's absolutely worth mentioning at your next appointment because your doctor has options. Sometimes lowering the dose helps. Sometimes switching the timing of when you take it makes a difference. Sometimes combining it with another medication actually cancels out the swelling. What you should never do is just live with tight shoes for the next 10 years without saying a word. There are simple habits that can meaningfully reduce your risk here. Stand up slowly. Sit on the edge of the bed for a few seconds before standing in the morning. Hold onto something sturdy for the first few steps if you felt dizzy before. Stay well hydrated throughout the day, unless your doctor has specifically told you to limit fluids for another medical reason. And if the dizziness becomes frequent, severe, or ever leads to actual fainting, that's your cue to call your healthcare provider, because your dose or your combination of medications may need to be reassessed. Let's shift now to something that happens quietly, often with zero symptoms at all, which is exactly what makes it worth understanding: changes in kidney function. Your kidneys are constantly filtering waste out of your blood, balancing fluid levels, and playing a direct role in regulating your blood pressure. Interestingly, Losartan and Lisinopril are often prescribed specifically because they protect the kidneys, particularly in people who also have diabetes. But like most things in medicine, there's a nuance here worth understanding. When you first start one of these medications, when your dose is increased, or if you become dehydrated for any reason, a stomach bug, a hot summer day, not drinking enough water, these drugs can temporarily affect how efficiently your kidneys filter blood. This is precisely why your doctor orders blood tests shortly after you start these medications, and periodically afterward. Those tests aren't bureaucratic busywork. They're checking two key markers: kidney function and potassium levels, to make sure your body is tolerating the medication the way it should. The tricky part is that most people feel completely fine even when these numbers start shifting. There's often no symptom at all until a problem has already progressed. That's exactly why skipping follow-up blood work is one of the riskiest things you can do while on these medications, even if you feel perfectly healthy. That said, there are warning signs worth knowing. Unusual fatigue that doesn't have an obvious cause, swelling that keeps getting worse rather than better, a noticeable drop in how much you're urinating, or confusion that comes on without explanation. These deserve a call to your doctor. They don't automatically mean something is wrong with your kidneys, but they're worth ruling out rather than ignoring. Which brings us naturally to a side effect that's closely linked to kidney function, and one that almost nobody feels coming. Elevated potassium levels, medically known as hyperkalemia. Potassium is a mineral your body genuinely needs. It's essential for your muscles to contract properly, for your nerves to send signals, and critically, for your heart to maintain a steady, healthy rhythm. Losartan and Lisinopril can, in some people, cause potassium levels to creep upward over time. And here's the part that makes this one sneaky. Mild to moderate increases in potassium usually cause absolutely no symptoms whatsoever. You could feel completely normal while your blood work tells a different story. This is why routine lab monitoring isn't optional if you're serious about staying safe on these medications. It's the only reliable early warning system you have. If potassium levels do climb high enough to cause symptoms, you might notice unusual muscle weakness, an odd tingling sensation, or persistent tiredness that doesn't match your activity level. In more serious cases, high potassium can affect your heart's electrical rhythm, which is precisely why doctors take this seriously, even when it seems abstract. One thing many people don't realize, certain salt substitutes marketed as heart healthy are actually potassium chloride in disguise, and potassium supplements can push levels even higher. If you're on Losartan or Lisinopril, always check with your healthcare provider before adding any salt substitute or potassium supplement to your routine. What seems like a smart swap for your health could actually work against you. And now, the sixth symptom, the one I mentioned at the very beginning, the one that so many people quietly live with for months without connecting it to anything, persistent fatigue. This is the symptom that hides in plain sight because tiredness has 100 possible explanations. And blaming a blood pressure pill is rarely the first thing anyone thinks of. But it's worth understanding the mechanism. These medications work by reducing the force and pressure of blood moving through your arteries. That's exactly what protects your heart and blood vessels over the long run. But as your body adjusts to that change, especially in the early weeks after starting a new medication or increasing a dose, some people genuinely feel more tired than usual while their system recalibrates. Now, I want to be very clear here, because this is where a lot of people jump to the wrong conclusion. Fatigue has an enormous number of possible causes that have nothing to do with your blood pressure medication at all. Poor sleep quality, low iron or anemia, an underactive thyroid, dehydration, low mood or depression, even a vitamin deficiency that's gone unnoticed. Blaming your medication automatically without a proper conversation with your doctor could mean you miss an entirely different and equally treatable cause. The right approach isn't to assume, it's to investigate. If fatigue is severe, if it's lasted more than a few weeks, or if it's genuinely interfering with your ability to do the things you enjoy, that's worth bringing up at your next appointment so your doctor can look at the full picture rather than guessing. So now you know all six. Swelling in the feet and ankles, a persistent dry cough, dizziness on standing, subtle changes in kidney function, elevated potassium, and ongoing fatigue. But knowing the list is only half the equation. What actually matters is what you do with that knowledge. Here's the single most important rule, and I want you to really absorb this one. Never, under any circumstances, stop taking your blood pressure medication on your own because of something you noticed in this video. Stopping abruptly can cause your blood pressure to rebound upward, sometimes sharply, and that rebound significantly raises your risk of heart attack, stroke, and other complications that are far more dangerous than any side effect we just discussed. This video is not permission to self-diagnose and self-treat. It's a tool to help you have a smarter, more specific conversation with the person who actually manages your care. So what should that conversation look like? Start by becoming your own note taker. When a symptom shows up, jot down the date. Note how often it happens, whether it seems to be getting better, staying the same, or getting worse, and anything that seems to trigger it. Time of day, physical activity, meals, heat. This kind of specific dated information is incredibly valuable to a doctor because vague complaints like, "I've been feeling off lately," are much harder to act on than, "My ankles have been swelling by 6 p.m. every evening for the past 3 weeks. The more precise you are, the faster your doctor can figure out whether it's the medication, another condition entirely, or simply something that needs a small lifestyle adjustment. Second, protect your follow-up appointments like they're non-negotiable. The blood tests, your doctor orders, After starting or adjusting these medications aren't a formality. They are quite literally the only way to catch silent changes in your kidney function or potassium levels before they become a real problem. Skipping these appointments, because you feel fine, is one of the most common and most avoidable mistakes people make with long-term blood pressure treatment. Third, build a handful of simple daily habits that genuinely support everything your medication is trying to do for you. Check yo. Our blood pressure at home periodically, especially if your doctor has recommended it, so you both have real data instead of guesswork. Stay physically active in whatever way suits your body. Even a daily walk makes a measurable difference over time. Lean toward a heart-healthy way of eating with an emphasis on vegetables, whole grains, and lean proteins while keeping an eye on excess salt, which works directly against what your medication is trying to accomplish. Drink enough water throughout the day, unless your doctor has specifically told you otherwise for a separate medical reason. Prioritize real, consistent sleep, because poor sleep quietly worsens blood pressure control and can amplify fatigue on its own. And simply keep showing up to your appointments, even the ones that feel routine. None of these habits are dramatic. None of them require a complete overhaul of your life. But small, consistent choices, repeated over months and years, tend to matter far more than any single dramatic change ever could. D. And that's true for almost everything related to long-term health, not just blood pressure. Here's the bigger truth underneath everything we've talked about today. High blood pressure has earned the nickname the silent killer for a reason. It typically causes no symptoms at all until it has already done serious, sometimes irreversible damage to your heart, your kidneys, or your blood vessels. That's exactly why medications like Amlodipine, Losartan, and Lisinopril exist. And it's exactly why they've helped millions of people live longer, fuller lives with a dramatically lower risk of stroke, heart attack, and kidney disease. These drugs are not the enemy. For the overwhelming majority of people who take them, they are quietly, reliably doing their job every single day, without drama, without incident. But being a smart, engaged patient means understanding that even the most beneficial medication can carry side effects, and that noticing those side effects early, rather than dismissing them as an inevitable part of aging, puts you in a position of strength, not fear. You're not being dramatic by paying attention to your body. You're not wasting your doctor's time by mentioning a symptom that turns out to be nothing. You're doing exactly what an informed, empowered patient over 60 should be doing. Paying attention, asking questions, and treating your own health care as a genuine partnership rather than something that simply happens to you. If any of these 6 symptoms sounded familiar today, the swelling, the cough, the dizziness, the fatigue, or anything else we covered, don't panic and don't ignore it either. Write it down. Bring it to your next appointment. Ask the question out loud. That single conversation, the one so many people put off for months or even years, could be the difference between quietly living with an unnecessary side effect and getting a simple adjustment that makes your day-to-day life noticeably better, all while keeping your heart and your blood pressure exactly as protected as they need to be. Before we close things out, let's quickly address a few questions that tend to come UP whenever this topic is discussed, because chances are at least one of them has crossed your mind while watching. Does everyone who takes Amlodipine, Losartan, or Lisinopril experience these side effects? Absolutely not. In fact, the majority of people take these medications for years, sometimes decades, without ever noticing more than a mild adjustment period in the first few weeks. These 6 symptoms represent possibilities to watch for, not guarantees, of what will happen to you personally. If you switch medications to avoid one side effect, could the new medication cause a different one? It's possible, which is exactly why any medication change should happen under medical supervision, with follow-up to confirm the new approach is working well for your specific body. There's rarely a perfect medication with 0 trade-offs. The goal is always finding the option that gives you the most benefit with the fewest downsides for your particular situation. Should you be worried if you've been on one of these medications for years with no problems at all? Not particularly, but it's still worth attending your scheduled checkups and blood tests, because kidney function and potassium levels can shift gradually over time, sometimes years into treatment, particularly as other aspects of your health change with age. Long-term stability is common, but it's not a reason to skip monitoring altogether. And finally, if you're currently symptom-free, but you're now a little more aware of what to watch for, what should you actually do differently starting today? Honestly, very little needs to change in terms of action, just awareness. Keep taking your medication exactly as prescribed. Keep your appointments. But now, if a symptom ever does show up, you'll recognize it for what it might be, instead of writing it off as an inevitable part of getting older. That shift in awareness, more than anything else, is the entire purpose of this video. Managing blood pressure over 60 isn't about fear, and it isn't about blind trust either. It's about staying genuinely informed and treating your healthcare provider as a true partner in the process. The medications we talked about today have an extraordinary track record of protecting hearts, protecting kidneys, and protecting lives. Respecting that track record means taking them seriously, both in how faithfully you take them and in how closely you pay attention to what your body is telling you along the way. Take care of your heart, stay curious about your health, and never underestimate the power of one honest conversation with your doctor.